Thanks so much for joining us this afternoon. First here at 4 o'clock. It's Oregon Governor Tina Kotek's first day in office, and she's already signing executive orders aimed at tackling the state's homeless crisis. Today, she declared a homelessness state of emergency. Blair Best joins us live from Salem with the details. And Blair, homelessness was a major issue on the campaign trail. Now she's tackling it in office.
Brittany, it's clear that the governor isn't wasting any time in her first full day in office. Now, during the months leading up to this point, she promised to put the homeless crisis at the top of her list. Well, today, she's doing just that.
So today, on my first full day as governor, I am signing 3 executive orders.
In her first full day in office, Governor Tina Kotek is focusing on one of Oregon's biggest challenges.
People are currently becoming homeless faster than we have been able to rehouse people who are living outside.
In a temporary office space inside the state library.
Remember, this is only my first full day on the job. I'm wearing sneakers because I didn't pack other shoes.
Growing pains aside, Governor Kotek started her term by signing 3 executive orders, including declaring a homelessness state of emergency.
Executive Order number 2302 declares a state of emergency due to homelessness,
and another aimed at building 36,000 homes per year.
The housing construction goal is ambitious because Oregonians are demanding bold solutions to address this crisis.
Governor Kotek is also proposing a $130 million investment to help at least another 1,200 homeless people move off the streets within a year.
Governor Kotek, just quickly doing the math here, the $130 million in that investment package, it breaks down to about $108,000 per person if you're going to use that money to help 1,200 people. That's quite a lot of money for each homeless person. Is that how it will break down?
Well, we'll be able to share more of those details in the coming days, but think about it this way. It's both rent assistance, which looks different than, building a new shelter, plus providing services. So it breaks down in different ways, but we'll try to get you that info as soon as we can.
She's expecting bipartisan support as she urges the legislature to quickly take up this investment package.
What I have heard uniformly, both from our Democratic leaders and our Republican leaders, is an interest in housing and homelessness. It's affecting all corners of the state. This isn't a partisan issue. And that in my conversations with the Republican leaders, they know this is a challenge.
Governor Kotek is also meeting with local mayors, including Portland's Mayor Ted Wheeler, to address homelessness in the state's more urban areas.
We clearly have a particular crisis in the metro area. Since the week after the election, I've been meeting with Mayor Wheeler. 2 of those meetings took place with the new Multnomah County Chair, Jessica Vega Peterson. We've been having very frank conversations about how we all work together. It is
Well, next on the governor's agenda is creating an advisory council to work on these executive orders. Brittany.
All right, Blair, thanks for that update. On the affordable housing front, $1 million grant will help Portland families get into permanent housing. Senator Ron Wyden and Senator Jeff Merkley helped secure the federal money to put up to 40 low-income families into permanently affordable home ownership. The grant is going to a group called Proud Ground, which creates those permanently affordable home ownership opportunities. According to a recent report from the Oregon Department of Land Conservation and Development, the state needs to build more than 550,000 homes over the next 20 years. Nearly a third of those will be needed for low-income Oregonians. Oregon has not built enough new homes to meet the state's growing population. Senator Wyden said it's one of his top priorities.
In this session of the Senate, I'm going to be championing MITEC, middle-income housing tax credits, so that nurses and firefighters and teachers have a chance to get a roof over their head.
Proud Ground has been working with low-income families for more than 20 years, helping families get into housing. They work in Clackamas, Clark, Lincoln, Washington, and Multnomah counties. Washington Governor Jay Inslee delivered his State of the State address today. He outlined his priorities, including salmon populations, public safety, and mental health support. However, a housing proposal appears to be his #1 priority. Inslee pitched a $4 billion proposal to help the housing and homelessness crisis.
That will significantly speed up the construction of thousands of new units that will include shelters, supportive housing, and affordable housing. This will be combined with additional behavioral health support and substance use treatment and employment services and more.
The governor will need legislative support and voter approval to borrow the $4 billion. We're hearing from former Thorns coach Paul Riley the day after he was permanently banned from the NWSL. Two former Thorns players accuse him of harassment and sexual coercion. Riley has denied those allegations, but two independent reports have outlined the widespread misconduct and abuse in the league going back nearly a decade. Riley told the NBC affiliate WRAL in Raleigh that he is planning to, quote, fight a lot of things. He says he has no interest in returning to the NWSL and described the league as, quote, political and woke.
We need the community to step up and speak up if they know something or see something about any of these deaths or cases.
The family of a homicide victim in Portland held a vigil for him last night as they continue to seek answers. This death is just one of the 96 homicides the Rose City suffered in 2022, a new record topping the previous year. And behind those numbers are stories, lives, and names like Nick Hammond, whose murder remains unsolved. His family's asking the community to step up for all of the victims.
He's much more than a number or a statistic. He has a lot of people that love him and miss him, and I miss him terribly.
You know that somebody knows who shot Nick. We know they do. If there was justice for the crimes, maybe the crimes would decrease.
Portland police say someone shot and killed Hammond on October 1st around 1:30 in the morning. It happened near Northeast 162nd and Sandy Boulevard. Crime Stoppers of Oregon is offering up to $2,500 for information leading to the arrest of his killer. A major drug bust in Portland. Portland police posted this photo on Twitter today saying an investigation with the DEA and PPB narcotics officers led to the seizure of 30,000 fentanyl pills and 2 kilos of powdered fentanyl. The value is nearly $100,000. A K-9 and East Neighborhood Response Team officers also helped in this investigation. All right, let's turn now to the latest on the coronavirus. Cases of a new subvariant of Omicron are on the rise here in the U.S. It's a mouthful, too. It's called XBB.1.5. And according to the Oregon Health Authority, COVID cases have spiked in the state, partially because of holiday gatherings. On January 4th, 723 cases of the virus were reported. That's 563 more cases reported than 2 days prior, but it is lower than the surges that we saw in 2021. Bryant Clerkley talked with our healthcare professionals today. And Bryant, they have some concerns because our hospitals are already at their limit.
Yeah, Brittany, and right now they're stressing if you're immune compromised, wear a mask in crowded areas. But some good news, we're in a lot better shape when it comes to COVID cases than a year ago at this time.
That we do have good clinical data to suggest that a prior vaccination series with the original strain and the boosters appears to provide good protection and long-standing protection against severe disease and hospitalization.
Dr. Katie Scharf with Kaiser Permanente says everyone should expect to get infected with COVID-19 if they haven't already. So getting a booster is her recommendation. Dr. Scharf says there's no clinical data to know if the current vaccine provides protection against XBB.1.5, but there is evidence being vaccinated helps with severe symptoms.
So individuals who are 65 and older, individuals with multiple medical conditions, individuals who are immunocompromised, or even pregnant women, those are the individuals we should really be messaging that need their updated booster.
She says the new XBB.1.5 variant is very contagious and spreading quickly in the United States. It accounts for almost 28% of cases across the country. As RSV and flu cases start to decline, health officials are starting to see a rise in COVID-19.
Hospitals right now, just with bed shortages and staffing shortages and a lot of sick patients, it's a really challenging time to be a patient in the hospital.
The symptoms of the new variant include cough, fever, muscle aches like the flu. At Lay Care Pharmacy in Northeast Portland, pharmacist Tan Lee says they've given out almost 25,000 vaccines since the summer, and things are starting to pick up again with this new variant out.
I see a lot of younger people to come and get the vaccine.
Over at Virginia Garcia Clinic in Hillsborough, Director of Patient Support and Safety Hazel Wheeler says they've been seeing an increase in the virus with their patients. Most of their patients are Hispanic, and the positivity rates are over 20%.
Lower income, so we have larger family structures that are closer together. We also have folks that are unable to call in sick, so they don't have the ability to isolate. They don't have the ability to self-quarantine.
And again, this new variant is very contagious, but Dr. Scharf says the good news, it's not more lethal than past variants. She says people who are immune compromised might have more severe symptoms. The doctor still recommends people get boosted. Brittany.